right?
There's actually one special syndrome. I don't know the English word, but in the military they know it very well, and this is very often with homeless people. That's I don't know. Maybe,
Soldatenfuß, right?
Yeah, like something like
Which
that.
is literally translated means soldier's foot. And since I have...
it is another word also in German.
I know what the word is.
It.
The word is called trench foot.
But it was, first it was in the First World War.
It's called trench foot. Trench foot was called what the infection that you would get if you're constantly in your shoes.
Yeah,
you're
right.
not changing your I'm not even a medical doctor, I know this. When you're not changing your socks, when you're exposed to water and other unhygienic situations.
And
it's called trench foot.
It's like the skin is
like soap?
Like soap and
like liquid soap.
And
it's swollen.
Yeah, it's swollen and that's
painful.
That's very similar with the military.
So for all those people anybody who's ever been who's a medical practitioner who's ever practiced in a medical field unit will know that a lot of what emergency medicine has learned from are from doctors who come back from military situations, because that's where there's the accelerated and exacerbated situations which require different forms of treatment.
Yeah,
but maybe also more rapid, because you only have so much time to have an impact on this person, right?
Yeah.
So trench foot is another example. So psychiatric, mental health issues, and trench foot.
Yeah,
wounds. These could be stab wounds.
Dermatological problems.
Psoriasis would probably be...
No, psoriasis, no. It's more... really infections and all this.
Like Ritze? I mean, what do you...
Yeah, that's an infection.
Yeah, so different types of
Scarpius. All these parasites.
Okay, so also like flea bites and other insect bites, spider and all that.
That's, for example, also points out how important it is to treat these people in an adequate way, because it also has an impact and influence on the people in the country, because those infections are contagious. So also
it's a social health issue as well.
Yeah, of course.
Okay.
If you do street medicine, you also help the other people, not only the homeless.
Now we're still on our checklist of classical medical, and there's the list is probably long. I'm sure that alcoholism, alcohol-based issues would be... Yeah,
alcohol, it's like a tree with a lot of branches, because alcohol causes such a lot of problems. But on the other hand, alcohol is the only medicine that they have if they have not an adequate medical treatment. Alcohol is for pain, is for sleep, is good for depression and to forget.
Well, we're not advertising here for alcohol.
No, of course we're not. But I mean,
it's their remedy. It's their household remedy
They look at it as a
universal solution, but it's
therapy,
actually
universal therapy.
But it actually creates a lot more damage.
Yeah, of course.
Is diabetes an issue?
Yeah, it is.
Okay.
But mostly diabetes that has been for a long time untreated.
Okay.
So most of them they don't even know that they have diabetes, because they are so used to it. The body got used to high blood sugar. Like if you would have like 300, you would be, I think, unconscious at least. But those guys, they come and you just, by chance, you just check the blood sugar and they have over 300.
It's interesting that you mentioned this, because I had a personal experience once with this as well. We, in front of one of the businesses that I used to work for, we used to have a hobo that lived there, a homeless person. He was a sweet guy, but he was a helpless alcoholic, and he used to greet us all when we walked in and out of the business. And every once in a while, we'd give him a couple bucks, or we'd have a conversation with him. And one of the things that totally fascinated me, over the years watching him, almost on a daily basis, I was fascinated. I said to myself, if I would live like this guy, I would live maybe for 3 months and I would pass away. And I worked at this place for at least 2 years, and I don't know how he survived. That's another thing I think, which is a medical phenomenon when you're dealing with homeless people.